Okay, family, was good. Let's see if we can go ahead and then open it up. And we're gonna open it all the way up. Miss Joe.
Hey.
Hey, peace. Ty, what's going on?
Hey, Miss Joanne.
Hey, John. These headphones aren't messing up, right?
Nah, you good.
Yeah.
I'm good.
Peace, everybody.
Good.
Hey.
Peace.
Hey, everybody.
Hey. This is sad. This is sad.
It is. It is.
Somebody's phone is acting up really
right.
It, you know, it's really criminal. There should be some criminal liability. This is sad. Mama Wanda was at this hospital.
Hold on for a second before we go any further. Wait a minute, somebody got some echo going on. Just a lot of echo, background feedback. If you got any earbuds, you want to remove them so we can be able to hear everything that y'all saying.
Can you hear me?
Okay, word.
Okay, can you hear me? Am I good?
Yeah, you good.
Okay,
Am I good?
All right.
No. Am I good?
Okay, yeah, it's your phone, Foot.
Okay.
Okay, go ahead.
Okay. This is the hospital that Mama Wanda was at, and when you look at the University Medical Center, their infectious disease care and service, it clearly states that it's since its inception that they provide care to thousands of people living with HIV and AIDS. That shit is on here. Let me see if I could. I mean, it's like that's the crux of their infectious disease program. The Dr. Patel, he's the medical director. He's an infectious disease specialist.
Mm-hmm.
And I mean, they don't send you home from the hospital in need of palliative care in the, home health agency support, home health assistance, if you are just on pain medicine.
Right.
You get home health care when you are gravely disabled in some manner, or if you are, I don't even want to say, because if they offered her, we did hear him say hospice, and we all know what, hospice is, end of life care. That's.
Well, can I say something? Okay, now this is a field that I am very, 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 very familiar with. I done worked in medical records, and I worked as a health unit coordinator. I prepared medical records. Now, one thing for sure and two for certain, that doctor knows everything about that girl before he even walks into that door. Okay.
Right.
And then for two, if he knows for a fact that somebody is on the phone and he can hear them, he is not going to display anything for them to hear. He whispered to her. Now, if it was just her and him in that room talking to each other and nobody on the phone, he would have told her exactly everything. Like all that what Nature Boy did was basically it was no reason for it, because it doesn't prove anything.
Right. But when the doctor walked into the room and she was talking, he said, we had that place set up for you. And she was saying, yeah, I know, but I didn't like the place. I didn't like the way that it looked. I didn't like the way they talked to me and all of that. So I don't know if it was a hospice care place that they had set up for her. So that's why at the end, Nature Boy was talking about they was trying to send her there, but we got her a place. That's so he can keep her next to him or in his whatever, his clutches.
Yeah, of course he told her to
Mm-hmm.
But he don't
not
even have
to
her no
deny that
place. He don't even have her no place though.
But he want us to think he do.
Right. He want us to think that, but he doesn't have her no place at.
Right.
Can't have her no place.
The doctor kind of confirmed it because he was basically saying like we gotta find somewhere to place you and your care to get.
That's where I want to stay at, right there, Cutie Shaw.
And Ty, you know, like you said,
Hold on for 1 second. Hold on for 1 second. I paused it because I wanted the sister to restart what she was saying again. Can you go into exactly what you know what I'm saying, interpreted from that with him trying to, get her somewhere or house somewhere just to make sure she good and she just is not in the street?
Exactly. So basically, when the doctor, she asked, when can I go home? And then y'all heard where he said, we tried to send him to this facility. I didn't like it, blah, blah, blah. He basically said, okay, we have to find you somewhere that you can go and get your care afterwards, like home health care, whatever, once you leave. On top of that, you still have to see the infectious disease specialist. So basically, if Nature Boy had her a place to go, that would have been communicated to the doctor, and the doctor would have said, okay, we're just waiting on such and such such, and you'll be able to go such and such such.
Right.
Yeah, she just can't leave. She has,
and that's the thing. He can't. Nature Boy can't determine.
Okay. Now, what was you saying, Miss Joanne?
Like, Ty, your area is medical records, so you would be able to, like open this up a bit more. But we all can recall her internal organs were out of place. And her sisters did state that it was from trauma, blunt force trauma. And we know he beat her. So if she presented with that type of diagnosis, physical abuse is definitely documented in that medical record. They know that she's a domestic violence victim.
Yes, that is in a
hospitals,
medical chart.
Okay, so they're trained to look for these things. So certainly the doctor can hear that damn fool with all of his ignorant outbursts.
Right.
And Malia thinks somebody crazy because you don't get an infection from your coochie after having a baby and it go all the way up to your chest. That girl infected from that bite, infected from the diseases and everything else. She never got treated for that bite. It was deep enough.
Hey, Carla, and what you're saying about that bite, you know what I'm saying? Ain't Shit Gang got at me, and I seen that Nola's World put it in the comment, and what she said as well as Ain't Shit Gang was that, when you go to hospice, it's like that's the point where they're just trying to make you comfortable with everything that's going on.
Right.
Can you touch on that?
Yeah, that's all they can do. I worked in the medical field also, and I worked with hospice patients. I went out to their houses every day. That's all they can do for you is come in and take care of you, make sure you're okay. Yes, she can go home with that drain, but it has to have a nurse to come there and do whatever she has to do, and then I will come in and do whatever I had to do. Groceries, cleaning up, shit like that. They just have to make sure you're comfortable. But she can't just leave that hospital like that.
No, she can't.
No way.
Where I just dealt with two grandparents who were both in hospice care, did it at home. They do not administer really any preventative medicines or anything like that anymore. All they do is give you pain medicine, be it morphine, whatever it is.
Right.
Comfortable, especially morphine if you have cancer. But they just do it to keep you comfortable until you expire, or very rarely I have seen one person come out of hospice care and go on. But that's rare.
Very, very rare.
So when she said just pain meds, that made me think of that too. But then it also made me think she was lying as well.
Of course, because due to the fact, like on before a doctor walks your room, for one, he in his medical, it's his doctor's note, and from the doctor's, a previous doctor, I don't care how many doctors she had, all of it is written in the note. And anytime each doctor go in there, they have to read that note. So that goes from history, from whatever her history was, to what drugs she taking, to what her plan is for her treatment for when she leaves, and while she's in the hospital. All of that is on that tablet or that, and he reads it. Everyone's supposed to read that before they go into doing a patient. So of course, if it comes down to like the abuse, and if, like you said, he heard that man in the back, of course I'm going to disclose anything. And y'all heard him whispering.
Yeah,
he whispered to her.
Let me unmute this person. Yaya right here. Yaya, I got you muted because your phone acting up real bad and you got some stuff in the background. How are you?
I'm good. How are you?
I'm great. So you got some stuff going on right now? Yeah, you got a bunch of stuff going down. Okay, I'm gonna drop you. I'll bring you back up here. Ty.
Hey, Ward, I wanted to touch on something.
Okay, go right ahead.
We didn't get to the end of the video, but at the end of the video, the nurse came in and told Malia that she was going to get her next round of antibiotics at 3 p.m. So she's on antibiotics as well as the pain medication.
Okay.
And while she's in hospital care. Right.
So at this point, hey, Ty, let me ask you, since you comment now, so what do you think about, when the doctor was talking to her, and what brought about that tear? Because I'm thinking if a person's leaving, from being in the hospital, as long as what she been in, she'd be happy. So what was that tear about?
That tear is because from when she first got on the phone with Nature Boy, she was sad. And all that fluid in my heart come from my attachments and all that other stuff. That was bullshit. I'm sorry. She is hurt because you cannot be a normal human being and be suffering damn near. If you are dying, you can't be satisfied with that information.
I think she's more hurt because he's not letting her come back because of it.
yeah.
I think she trying to let them know something too, because you heard how she was with the doctor. Did y'all peep how she was acting like she was trying to get him to see what's going on to report?
What you mean?
Right? But
Like how usually, like when they come in, she'll hurry up and get off the line. Like even after the questions got answered, she stayed on there and continued to let that man see how Nature Boy treated her.
right.
I feel
But
like
did
she
you
was
hear him
crying
tell her?
out for help a little bit.
She did. I'm sorry.
Yeah, because she was looking in the camera and she kept, how you do your lips, a certain way when you trying to signal somebody to let them know that this person lying or something like that.
Yeah, like blink.
I kind of felt that from her. She was doing that in the camera.
I hope
When she was looking down, looking at the camera, she kept doing that with her lips, like every time when Nature Boy was talking.
Yeah, she said I have to stop it. I have to calm down because the doctor is here. But that idiot
Close my door.
did not discontinue that call. And she's so programmed and afraid of him that she did not hang up the phone. But she did say, I have to calm down because the doctor is here.
Right.
Yeah,
She did say that.
And he insisted.
that's one of the biggest mistakes that the dumbest thing that he's done thus far is allowing her to stay on their phone. But he's such an idiot. I mean, he doesn't. I mean, like, why do you want her to continue recording while the doctor is in there? The doctor could have said everything. You know what I'm saying? Smart about it. Go ahead.
Could the doctor hear Nature Boy? Like, could the doctor hear Nature Boy through the phone?
Yeah, he heard it.
Yes.
So maybe the doctor could have noticed something that wasn't right with the whole situation, how she was acting while he was on the phone, being so aggressive. Maybe
That's what I'm saying.
Right. That's what Shar and I was saying. Kulu, that doctor knows everything about that girl before he walks in that room. Okay, so if he hear an aggressive man in the background, he is not going to disclose any of that type of information.
And he even said it. It's private information and things like that in the video.
Right.
If the doctor gets a little like an iPad, or he used to get like a little it's one of those things called where you fold it and you put like a little pamphlet, you open it up and it has like the patient
notebook
needs, and he walks in there and takes care of the patient. So he definitely knew what was going on. Y'all are perfectly right, man. Nature Boy fucked up when he wouldn't disconnect her from the live stream. When he kept asking him and let his emotion get a hold of him, I guarantee you that doctor knew something was wrong and can sense the energy and the aggression is coming from the person from the phone.
And if you could look at it like this, y'all can look at it like this, right? And y'all can look at it like this as well. Nature Boy could have been throwing that out there, knowing that that doctor wasn't going to say anything.
I was thinking that too. I
noticed.
He knew the doctor wasn't going to answer them questions.
Yeah, I noticed a few times too when the doctor was talking, like, his volume kind of got high. And then as well, what I was indicating with the flower that was on the table and how it was just like barely, like just moving, the plant was just barely moving. It kind of seemed like Nature Boy was trying to drown out the doctor from everybody being able to hear what the doctor was really speaking about her medical condition.
Right.
Which he is good at doing. He loved
because the cat was dogging him out.
Yeah.
But he's so stupid that he be so busy trying to prove something.
Yes.
That we already know is something else that he don't cover his own ass. In the midst of him trying to cover his ass, he always leave his ass out there at the same time because he's just that stupid. He let the ego, one side of him is trying to do this, but he's always digging himself an extra grave every fucking time. It's like, dude, you don't see what you fucking doing?
Yes.
Like you play yourself every time.
Okay,
even when
he directs him.
Right, when he can't have a cam up while she's in the hospital, then finally she slipped up and showed her medicine. So it's like you ain't gonna learn from that. Like what, you steady fucking yourself.
And y'all notice how he tried
He's always the director.
Right.
He tried to put that on the sisters. The sisters didn't have anything to do with the HIV situation popping up.
Exactly.
Right. That was his doing. Having her cam up and let cam up. And she cammed up and slipped up, and now they looking fucked up. And he's trying to correct it, but he's steady digging deeper and deeper. He just don't know how to disappear. He don't know how to do that.
That would have been the best thing to let Malia, even if he was still in contact with her, just let her do her thing offline. Right. We wouldn't have been able to find out all this stuff.
Nothing, and that's what I'm saying. He's so smart. He's stupid.
Yeah. Did y'all not notice that usually when he gives her a direct order or when he's coaching her on what to say, that, she'll repeat what he says verbatim. But when he specifically said, ask him about, the HIV or are you taking HIV meds? When she turned around to ask him, she did not ask him that.
Yep.
No, she didn't.
Yep.
She kept using AIDS. Because AIDS and HIV is two different things. So just in case he was, I guess she not smart enough to know the doctor can't answer that type of question.
She's acting for records.
Yeah,
she kept saying AIDS.
She said it once. She said, can you do you have my medical records? But that's not what he told her to ask him. He specifically said HIV. And usually, like I said, she will repeat exactly what he tells her to do. But she didn't.
And that doctor wasn't going to disclose that because he heard him ask her.
Exactly.
Hey guys, hey panel. I jumped on real quick. Oh, sorry.
Oh, sorry. Go ahead.
I jumped on real quick just to add this. So I work in the healthcare profession. I'm a nurse practitioner. And so Malia's whole situation, we've dealt with people at my hospital who have been unfunded. Like she is, because she hasn't worked. She has no health care insurance. She's been over there fooling with this shit for like the last year. And so all of this stuff that she has going on with the infection and the HIV and all of this kind of stuff, they cannot legally discharge her to nowhere or to the streets, considering she still needs continued antibiotics. This whole lie Nature Boy created with this putting her in a luxury Airbnb and all of this other stuff is just bullshit. They probably sent her home, or probably sent her to like a skilled nursing facility who takes charity cases, because they do have those around. And she didn't like it there, so she came back to the hospital. The next thing to do is to send her to another nursing home or wherever she can go with charity. He's estranged her from her family, so she can't go there. That's another reason to be sad, and she's realizing she has nowhere to go because this nigga's not gonna do nothing for her. Like he's pretty much got her online, making her look stupid and just fucking abandoning her, which pisses me off, and it pisses me off with him and her. But I'm gonna take my emotions out of it. So all this hospice stuff, if she was on hospice care, so we can death the whole hospice situation, they would not continue to give her antibiotics. They would not make follow-up appointments with her to these different disease specialists and all this other kind of stuff, because hospice is for comfort only. And so that's all I really wanted to add. I'm gonna drop back down in the chat because I'm at work, but that was what I had for y'all.
Okay, bet. I appreciate you sharing it, you know what I'm saying, with us as well, and clarifying everything. That's the whole fact. I'm gonna go ahead and then unmute everybody as well. I wanted everybody to be able to hear what you were saying, because that pretty much, explains it all with, with what I at least thought, in reference to her not having anywhere to go, because as it was stated, to a degree, she was saying like, I didn't like it there and stuff like that. So now you pretty much made that make sense. I appreciate that.
No problem. Exactly. And then at the hospital I work at now, they have what they call a transitional care unit that specializes in people like her who have no insurance and have nowhere to go, who still need continued treatment. So it's a whole situation she got going on.
Do they have
another place for her? Okay, so she's gone. Oh well. So she was saying they're releasing her from the hospital because she has had an extended stay. So she needs to go to another facility where she can continue to get care. Is that what she was saying?
Yes.
Yeah.
Okay.
I'm trying to mute.
So they mentioned something about hospice, because I missed this. Maybe I need to go watch this video. They said
Yeah, the hospice thing came up as well, but I just was more or less wanting to get a better understanding of what he was saying, with releasing her, because if you noticed in the video, that was kind of prolonged with everything that he was saying. If it's time to go, then it's time to go, right? If you're going somewhere else, if you're going to move to another part of the hospital, then it's time to go. She's steady on the phone talking to him, buying time, and when he was giving out the information, he kept over talking her.
Right.
So in the end, Nature Boy was explaining how he had gotten her that she wasn't in. They tried to send her to this other place, and he started out saying either hospice or hospital, but she cut him off.
She cut him off. Yes,
right. We couldn't really hear if he said hospital. So apparently it was like another hospital or another facility for extra care.
Right. Can I add to this a little bit?
Yeah, sure. That Nikki?
Yeah, this is Nikki.
Okay, good. You go right here.
Hey, Nikki. Hey, how everyone doing?
We're fine.
Okay. When she was speaking and the doctor she was asking the doctor, she said, well, I want to know, when am I going to be released? I couldn't really hear what the doctor was saying to her, but if you guys pick it up, what she was saying is whatever facility that they sent her to, she didn't like the way the people was talking to her and was handling her. So that's what landed her back to the hospital. Okay?
Yep.
Now,
Exactly.
at this particular time, what Malia is doing is wherever they send her, she's acting like she don't like this place, she don't like that place, because she wants to strike a confusion, because she really wants to go to carbonation. And at this particular time, due to her being on these psych medications that we have Googled up that came off of her med chart, she has no power. She has no power to make. She has no power to decide where she's going. At this point, I believe everything is into
whatever social worker or case manager she's dealing with.
I don't care.
Now,
Somebody
when
put in the chat, they put in the comments, Stay Real says she is dying for sure. God bless her. Do y'all believe this is what's going on?
okay, now listen now. Remember when Nature Boy slipped and said hospital and Malia threw her hand on her mouth? Like, damn, you didn't let it out. Do anyone remember that?
Yeah.
She appeared
I did see how
devastated.
she cut him off and stuff.
But I'll say this: when whatever this facility was, I highly doubt that she was not pleased with the way it looked, the way they talked to her, because I mean, certainly they would show her some degree of care, being that she is being transferred from a specialized infectious disease program. They weren't treating her unkind. What I believe could be is that she was not pleased with the restrictive environment. She probably could not have access to internet. He did not have the level of control if she was in this other setting that he would have over her, if she was somewhere else. And I think that he made her disagree with that placement.
That's what I was
She's
saying.
definitely this program where the hospital where she is, they have their infectious disease program clearly states that the care is for a wide range of care and services for people living with human immunodeficiency virus and other infectious diseases. This child is gravely ill. She's gravely ill. She's gravely ill. This child is gravely ill. There's the HIV outpatient program, and
that's the part that I'm gonna get to now. Hold on for 1 second, and I'll go ahead and then get to that clinic and everything about that clinic. Well, I'm gonna give my Siri a little bit of my damn translator. I'm gonna give it a little bit of audio, and we'll go from there.
HIV Outpatient Program. The HIV Outpatient Program, HOP, is an established ambulatory care department within the Infectious Disease Services of University Medical Center New Orleans. HOP has been recognized nationally for its multidisciplinary approach and serves as a medical home for people living with HIV. Many services are available to people who receive their primary medical care with HOP. Some of the services include social services, behavioral health, dental care, health education, nutrition education, lab services, dental services, and medication assistance. Specialty services may also include women's health services, pain management, diabetes management, lung and breathing management, and oncology services. HOP provides both comprehensive HIV care and pre-exposure prophylaxis or PrEP. A way for people who do not have HIV but who are at very high risk of getting HIV to prevent infection. HIV testing services are also available at HOP. History and mission. The HIV Outpatient Program, HOP, is an established ambulatory care department within the Infectious Disease Services of University Medical Center New Orleans. HOP was founded by Dr. Ted Wisniewski in 1987 as an outgrowth of the Medical Center of Louisiana at New Orleans Charity Hospital Infectious Disease Clinic. Since its inception, HOP has provided care to thousands of people living with HIV and AIDS. The mission of HOP is to support and promote the health and well-being of people living with HIV by providing high-quality healthcare services.
I mean, all of the literature that I'm looking at for this infectious disease specialty program within the confines of this medical facility, the reference is continually to HIV, and on the back end they say and other infectious diseases. And the jackass, he constantly wanted her to confirm publicly that, oh, you don't have STDs or whatever the hell, trying to get that confirmation, knowing that a doctor, no doctor, the worst doctor will not go on record over a damn cell phone. The man can see you, a jackass is on the other end, would not even agree to speak professionally to that type of setting. That
he knows
that
what he was doing.
Oh, he knows, Nikki. He knows what he was doing. He knows he was not going to get an answer.
Do you were trying to bomb rush him to where like maybe he thought in his mind that the doctor would be caught off guard and say no. Like trying
no, that's a professional. No, indeed. That's a professional. That man lose his life. He's not going to lose his life. No, he's a professional. He do this in his sleep. He's not going to do that.
Right, an educated, trained, sound mind professional slipping up to a criminally insane individual that was once long-term placed in an insane asylum and certainly needs to be picked back up and brought back again.
The ones.
Now, and then you already know the family done already told the hospital that hey, she was exposed. This was going on. The Baba G dude is so and so. So Nature Boy not making itself look good, darling, because the nurses and everybody else already know what they dealing with. They can go in the room and smile. Hi, Tanisha, how are you today? And not speak on him at all.
And then you heard how he was screaming.
Can I say this? I'm sorry, y'all, but can I say? I mean, everybody just got to use basic common sense. This infection or infection that is not that serious, she would have been out of there. If it was something that antibiotics can treat and she could go about her business, she would not be there right now. So we're going to kill this whole, it's not this infection is not a big deal. It is.
Especially when you got to stay somewhere 2 more months after the fact you've already been in the hospital a month or almost 2 months. So you got to get 4-month treatment care. Correct. It's not serious.
Oh no, cancer patients and patients that had severe things haven't been in there that long.
Because she hasn't been treated.
Do you think the doctors
she has not been treated.
Do you think the doctors can hear like Malia on her phone listening to Nature Boy? Like, do you think the doctors can hear in the background?
That's not even a question right there. And the reason it's not a question because they was on live. You see what I'm saying? It ain't like they was on audio live. Nature Boy was the only one that was, on the audio live because he had the avatar up. See, he didn't have the physical up. You know what I'm saying? He had a visual where you could see him and all that. So the doctor heard all of that disrespectful ass, ignorant ass nigga shit that he was saying on the phone.
But do you think, like past days before when we seen her on panels a week ago, do you think the doctor maybe would have been listening in on the conversation?
They don't have to listen
in the same spot. She wasn't in the same spot.
Usually people that are probably sending them the videos, the information, the family saying, hey, look, this is what's going on. This is what these people are well aware of what's going on, who she talking to. She talk whenever the nurse in there. She's so loud. She got it on speaker. Baba G this, Baba G that. They know exactly who this man is. If the family members say, hey, this man is named Nature Boy, Alicia Bishop, they curiosity when they go home, they gonna look up and see who's this dude that you're talking to, and they gonna see all this shit for themselves, and they already know, like, that's why she on those meds. You know what I'm saying? Like, they already know that, hey, this is something deep. I don't understand why they can't do anything more about that, but they know exactly what they're dealing with.
But hold on. Let's not even disregard the fact of what her hiding her face. Her eyes could have been talking to that doctor.
That's what I'm thinking. Also, and you heard how he was calling her Malia. Her name is Tanisha. That doctor know her name is Tanisha, and he hearing her scream, hearing Nature Boy scream, Malia, Malia. Ask the doctor, Malia.
Damn.
That's exactly.
He was that loud and stupid, y'all.
That ignorant.
Yeah. Cutie, can you go a little deeper into that right there?
Yes, just because like the doctor is here. Okay, the doctor coming in there, like Ty said, the doctor know everything about this patient. So the doctor know this lady's first, middle, and last name. He know on her chart that it don't say nowhere that her name is Malia. And this man is asking her, Malia, Malia, right in front of the doctor, Malia. Ask him this, Malia. And I know the doctor like, who is Malia? But she's answering to it. So, you know, that's already raising flags in his head. Like, wait a minute. She don't even know her identity. She don't even know her name.
Yeah, they already know all that. They probably sitting around documenting all this shit. And right, because you know the doctor have to come in and write down the patient's behavior, your demeanor, and all that. So they probably just logging all of this shit in, and it's doing him more harm than good. He's so busy trying to prove a point to us that we don't believe you regardless. So saying we
and I want to say, wasn't one of the meds that Nikki read off? Wasn't that for like psychosis or something like that?
Exactly. And that's why I said one thing when it comes to a hospital, I'm going to tell you how they work. Even when they are investigating your behavior and the things that you're doing, trust and believe they know what's going on with Nature Boy. But they're not going to say anything. They know everything. They know what's up. Don't think for 2 seconds they don't know what's going on. Because every time we come in here to deal with you, you on the phone with this same person. Now, what is your ties with this person? What is going on?
But they do. But Nikki, I have to cut you.
Okay, no
right
problem.
there.
Go ahead.
Because they do. Oh no, I'm sorry. No, I do want to say that they do have case. They do let caseworkers and social workers and everything. They get it. It doesn't matter. Like anything like that, it's a caseworker involved.
Exactly.
And it's or a social worker involved.
Both of them.
Yeah,
that's why she
right.
Not
They
being
know exactly what's going on.
You also got to know this too.
Mm-hmm.
When HIV is involved, the health department is involved.
Correct.
And when the health department gets involved, we want to know who all you were.
Right.
Yes.
So
okay, let me ask at this point right here, Nikki. Okay, so being that the health department is in fact involved, do you think that this will push further with or either open up an investigation now?
I think it's not only if he's talking, but I'm gonna tell you one thing how they do with these psychologists. When they dealing with people they know that is holding back information, what they do is they use different technologies. See, Malia have them spilled the beans under medication and don't even know it. So when you have a disease like that and it makes it to the health department wants everyone that you are involved with. Now, I don't know how they do in Puerto Rico or where she at, but I know here when you have HIV, AIDS, or anything of that nature, you are reported to the health department.
Yep. I want to add something else that I caught the doctor say.
Hold on. Before that you do, anybody with the background noise, if some children are around, if you can move to another room. Thank you.
Now, I'm going to say this here. Once the health department gets involved in those social workers and that case manager, somebody going to tell something about the HIV. That's not going unnoticed.
So, did y'all peep? The doctor asked Malia if a student could come in and interview her.
I peeped that.
I'm gonna tell you, I don't want to expose my business, but I've dealt with like the psych ward before and how they work and stuff. So they might even be trying to play her, acting like, you know, like this person is a medical student, just asking her some questions, but they really trying to get information to keep her held in that hospital, like on a psych restriction or something like that.
They've seen abusive patients before, and that's what I'm with Miss Danny is, you know, is when it comes to patients like that, like, do they have a certain section for abused patients that come in for like domestic violence or things like that?
No, they don't. They put them in
Okay.
the regular population with everybody else. They don't separate them, but there are alerts on the chart, and the staff is alerted to be aware. And I think I was on another live before when I said that they could have, her family, when all of this initially started, should have made her a no information patient. So none of her information could have got out, only except to family members, and they should have took power of attorney over her at that point. However, they didn't do that, and I'm sure it's because they didn't have the correct information or resources to get it done, which is why we're in the situation that we're in now.
So you work on
Okay. Did anyone hear when nature? Did anyone hear when Nature Boy said, "Well, just to let y'all know, she was released out the hospital, but they tried to lock her up in another place." The key word was lock.
Yes.
Okay,
And
if
the
you
site
are
specifically.
released on your own free will, how could they lock? The key word is lock.
Yep.
First of all, that means you have no consent over stuff right now.
That's why she was crying too. When
Exactly.
when she asked to go home and they gave her we don't know kind of, you know what I'm saying? That's why she started crying too. Like, I'm stuck. I'm really stuck. Like,
Yeah.
Because she
Now-
can be on the
Now,
site
when she
unit
went to
getting
this, when
care.
she went
But
to
a
the
site-
facility, whatever this
Go ahead.
facility is that they were trying to lock her in, when she went to that facility, if you think about what she said, well, I don't like the way the people was talking to me, such and such and such. She was rebellious about whatever place they was locking her in. So at this point, you don't want to be here, we take you back to the hospital. Yeah, you were readmitted because you were about to go somewhere else. You're not
Right.
going on your own free will.
Yep. I peeped that. Lisa, you were saying that you were talking about some of the meds that you caught from the board were psychological meds, right?
Yes.
Okay, and so Nature Board would want people who don't know him to think that, you know, he kept saying, "Oh, this is just some random doctor. He don't know her records and stuff." There is absolutely no doctor that's gonna walk in your room and he said, "My name is on your board." That's what
on
he
your board.
and so he knows everything that she's taking, also the psychological.
Okay, well, let's touch on that. Okay. She said the only doctor she has is for her heart. And then Nature Boy said, well, she got more than one doctor.
he said five. He said she got five doctors.
Okay, now let's get into that. If you have 5 doctors, what is these 5 doctors for if you only have a heart problem?
Make it make sense.
Now let's get into that. Because you just don't get 5 doctors for no reason.
No,
You may get 5 doctors, but you're gonna get 5 doctors that's dealing with each health issue that you have.
Right.
You might have an AIDS specialist. You may
Mm-hmm.
have a cardiac specialist.
Yep.
You may have a psych doctor.
Mm-hmm.
Okay, let's get into it.
Yep.
Right. So she was also caught in a lie because she said no. She told him, "I know for myself what I'm on. I'm on pain meds." And then the nurse walks in the room and said, "What she say, child? In 2 hours, you're gonna
3
get."
o'clock. 3 o'clock, you get your next dosage of antibiotics.
Thank you. So how you on it, Kara? Come on.
Okay, now let's get into
You
this.
said 3
here.
o'clock? Wait, 3 o'clock what time? AM, PM?
Okay.
PM, because it was like around 1 o'clock, 12 o'clock PM. 3 o'clock.
Yeah, the time is another thing. Wait, before we go any further, now Dekulu, now with this time and by you asking about whether it was PM or AM, what's going on with that? Can you kind of go into that a little bit, brother?
Yeah, by how often she had to take her medicine, we can really cross examine the screenshots and the names of the actual medicine to see if it fits within the actual time frame in which you're supposed to take the medicine, to see if it actually is true. You know what I mean?
Okay, one of her medications, the one that was for the HIV, that was a morning medication. You know, by her just readmitting herself, that could have thrown things off a little bit. You know, we got to look at the whole scenario here. She did
So
leave,
he's coming
and
back.
then she did come back. So
They could be having to pump in extra antibiotics from her, you know, going without the care for a little while or whatever she had going on, running away.
now I did see a different. I've seen a different background when she came on live. One of those days, it was like a lime green background, and I saw a ceiling fan, but it was on the lines of a facility. It wasn't on the lines of a home. Now,
I noticed that too.
now, just because something else I want to get into. Now, why do you need a constant IV?
Right.
Okay, now my ex-husband passed away from prostate cancer, and once he gets to the last stages, you can't take certain antibiotics by mouth. You need direct antibiotics to just keep you living. Okay, and those antibiotics are given in an IV. So let's get into this. Now you've been there over a month. You are taking direct antibiotics in an IV. And when anything gets that serious, when it gets to that point, it's serious.
Yeah.
So let's just make it make sense here.
No light love. I see we got you up here too. What's going on? You want to add on?
Not only that,
I guess not.
You have to have a home health care to give you your medication.
That's what the doctor was saying. I think I thought I heard him say that basically.
Yeah.
Like,
That's what he said. Now, if you are able to go home, you should be able to give yourself your medication.
Correct.
So whatever this medication is, it must be a very serious medication. It has to be a doctor or a nurse has to do it.
Exactly.
Yeah, because it has to be in an IV, and
She can't administer it herself.
What's the next medicine again?
Hold on. Hold on. Can you mute me? Well,
Once again, whoever up in the house, you know what I'm saying, with the children, I understand if y'all keeping children, stuff like that or whatever, man, but kind of, you know what I'm saying, mute up with the mute up, you know what I'm saying, so we don't hear all that. We trying to hear exactly what's going on right now, all right, y'all?
I don't have no children.
Hey, what's the
All right, we're going to be on mute for a minute then. Let's go ahead and tighten up with the tighten up now. You know what I'm saying? If y'all got something in the background, kind of move to like a quieter location if you can, all right?
Yeah, Miss Nikki said something about muting her because she got kids in the back.
yeah, I had a little issue. I took care of it. Okay. Next.
Good afternoon, everybody.
Good afternoon.
When
Last night after you let the congregation go, I did a little trolling.
Okay, I have to ask you to lower the volume on your phone. If not, it's going to cause the other audio to start echoing and cracking, okay?
Okay, I'm sorry. I had my Bluetooth on. I'm sorry.
You
Is that better?
lower that, please.
Is that better?
Lower the
Yeah.
volume a little bit, okay?
as well, everyone knows once a disease gets into the last stages, it goes and it attacks the organs, which is your immune system. You have a lot of organs that's been affected. So everyone knows once the kidneys get affected, the heart get affected. What else it was that she had going on?
Me, heart.
She had a cyst on the ovary.
Yeah, cyst on the ovaries, cyst somewhere else.
Her liver.
Yeah.
Every darn organ down there seemed like the major ones.
Yep.
Okay. So everyone knows when it gets to that point what time it is. You know, I don't like to say that stuff because I have experienced some things like that. But when it gets to the point where you build in fluid, and pneumonia. Those are like pretty much the last stage of whatever disease it is that you have. Everyone knows that.
Okay.
Now, what they
When you say last stage, of the disease, what exactly are you saying? You know what I'm saying with this last.
Okay, I can give you an example from experience. I took care of my mother, my father, and my husband in hospice. And the end of each one of their life of their diseases was the fluid filling around the heart. And what happened is in the last stages of any disease you will develop is called pneumonia because your organs and things is not functioning right. But what they will do to prolong things, they will give you different and numerous of antibiotics. But what happened eventually is they try all the antibiotics they can. It will respond. It will keep you going. It all depends. 2 weeks, 3 weeks, a month. That one won't work no more. They'll give you another one. Then it gets to the point of the injection, the IV antibiotics, which is to the point where it would just prolong you. Is what I'm saying. Once fluid and things start to build around the heart and different places like kidneys and stuff, which I dealt with this 3 times, I knew it was pretty much a wrap. Okay. Now, I'm not saying that with her case. I'm just telling you of experience.
Okay. Now to the sister that commented early, Miss Danny baby, you said you had to get back to work. Are you chiming back in with us now?
Yeah, I'm back in with y'all.
Okay, you got any feedback on what Nikki was saying and what's going on?
So the difference is, so Nikki, what was your family member suffering from when they were on hospice?
Okay, one had vocal cord cancer and COPD. And then my husband, he had prostate cancer. And then my mom, she had Parkinson's. Now, towards the end of diseases, it don't be the actual disease that actually takes you out. It be the immune system that cannot hold up anymore. So usually what happens is this. You will either go from a urinary tract infection or pneumonia. It's the two common things.
So the difference in Malia's case is that she's not suffering from cancer. So every disease process has its own pathology that it follows.
Exactly.
So every patient is different, right? So with Malia, we know she had these untreated STDs, which is when she first came out and said that she had fluid around the heart. I had already light bulbs started going off in my head. Also, she has HIV, possibly AIDS at this point. With her being so young at the age of 21, 22, in the medical profession, we look at age as kind of like a life-saving grace because usually your age works more on your side than it does for the elderly. So she is a little bit more resilient, and her body does have the ability to bounce back some from all of this, which is why the need for the aggressive antibiotics and all of that stuff. If they treat the infection that she has going on, which it seems like they're accurately treating at this point for as far as they
Man, y'all can't read. I put in the comments. I said 1 second. I be having this computer in a whole another different room. Yeah, my bad, family. I got y'all. You know I got y'all. Hold up, man. Just chill. Damn. Yeah, you know we up for this shit right here, man. That's a whole damn fact, man. Like I say, you know, with the coverage on all of this stuff, man, especially with Malia, this shit is crazy as hell. I'm literally to the point right now. I'm just like, fuck. You know what I'm saying? Like, this shit is crazy as hell, man. And I also think about, you know, of on how detrimental that the situation is, you know, for her, and how people still are not speaking about it, which I do find to be strange as a motherfucker, man. People be putting more energy with weak videos and low views talking about me as opposed to talking about the situation with the cult leader. I think a lot of that comes from a low level of definitive terms to use and just being a bullshit ass YouTuber too. But it is what it is though. Yeah, it is what it is. You know, we don't be tripping on none of this stuff out here, man. The main thing we want to do, man, is just to continue to make it make sense. That's the objective. That's the agenda within itself. Man, look here. I don't know what the fuck Clubfoot gonna do now. I don't know what he gonna do. He fucked up in the game though. That's for damn sure he fucked up in the game. Yeah, we're gonna run this joint all the way back. Yeah, and then watch it again. See if we can't get a few more jewels. Yeah, let's see if there's a few more jewels in here. And that old tablecloth video. Hold on. I hadn't seen that part when they were sitting there coloring and shit. I want to snatch it up as soon as you get on here. And then we'll rock out for a second. But let me give y'all just a little volume. Give me time. I can go ahead and then get the snack right quick. You feel me? Right. I'm about to come up with the snack. Then I go back on the joint. We'll listen to it again. And the reason, like I say, why I want to listen to it again, because it may just been something that we missed when we was live that first damn time. Yeah, we'll go ahead and just jump right back in while we up. That's right. You know how we do over here any damn way. Let's go with it. Let me see.
Our woman shouldn't have to sit here and really talk about nothing that's going to be questioning them unless they teaching you how to do a head wrap or something like that. But sitting here being you know, scrutinized about what they believe in. You want to know what I believe in? Talk to Baba. Right. You know what I'm saying? Because Baba teaches this. You know what I'm saying? You don't have to be scrutinized. You don't have to be outspoken. You could be inward spoken. You could do your art. Channel that energy that you get from me into your art, into whatever you want to do. And when it comes to Malia, I just saying when it comes to Malia, because she's in her predicament, she has to speak up for herself, because I can't, you know what I'm saying? I can't speak up for her. You know what I'm saying? Like if I say something, I'm talking for her. But Malia and this sicker says but y'all don't gotta explain shit to nobody. Y'all don't gotta answer no questions. Y'all don't have to be articulate. Y'all don't even have to talk. Matter of fact, you could talk to people that, you know, agree with you and everything and be like da 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 da. But really, it's not really to talk about. I said it all. You know what I'm saying? If you want to know about anything, go to Baba G, go to Nature Boy TV. Yeah, you just repeating me, and it sounds like y'all regurgitating what I already said. So ain't no sense of doing all that. But when it comes to like situations that are actively happening with Malia, Malia should be able to speak for her own situation. Yes. And at the end of the day, if she wants to, if she feel like Baba G being attacked as a woman, as a mother figure, as a wife, as a woman that is in this journey, seeing me get attacked for something that's happening to her that has nothing to do with me, it is only right and honorable for her to step up and speak in my defense and her own defense. Because at the end of the day, they're going to try to use that against her and me. And I don't think that that's cool. That's a distraction. Come on in, fellas.
Come on in, fellas.
This journey ain't for everybody. Oh, they got the fire, y'all. Don't give it to them. Go ahead, let them put that in front of the camera. TT, we got the
Grateful, Baba.
we got the delivery man.
Y'all get the
They're gonna deliver it right now. They come and deliver it. They're coming to deliver the box for y'all right now. TT, we got the fryer. Y'all open it in front of the camera.
We making soap tomorrow. Oh, he said we can.
Y'all hold the camera for us, Solar.
Got it.
This is a gift from TT. She sent the gift. We're gonna show them unboxing it. The air fryer. Appreciate it, TT.
Air fryer. What? I mean, wait a minute. I'm just beyond confused right now. Why would a guy that calls himself Nature Boy, why would him and his wives be excited to actually receive a gift, which is an air fryer? Ain't this shit getting stranger, man, by the second?
Hold on, what?
Air fryer?
They turn the joint around.
Oh, yeah.
Turn the joint around. Just that.
This is weird.
All right, boy.
Fucking air fryer?
Oh, there we go. Joint huge.
Women are more than likely. Most of y'all women are not articulate. You just run your mouth a lot. It didn't even make no sense.
French fries today.
So why couldn't they just have went to Walmart and got one?
She said, what y'all making?
You put anything here. The stuff that says fries, chicken, steak,
Good looking out, TT.
Oh yeah, I heard you can make cake. We can get cake here. Brownies? I found that out really good. You probably fry the brownies with chocolate cake.
Fry the brownies.
That's what it is. That's a
Straight
big
out of
one.
Ethiopia. Are you wild, yo? Thankful. Thankful.
Yo, y'all put us on the box, man. Come on, man. Put us on the box, man. Come on, don't play.
What's on the box?
Y'all put us on the box, man. Ain't no way y'all not. Hey, yo.
Right. It's no way that we not on the box. That's what
I'm telling you.
Wipe the back of the
Y'all not gonna support the real though? For real? Y'all not gonna support the real? Really? But y'all support the fake though. Come on, man.
Yeah, they support the fake.
Come on, man.
Hey, mama.
Peace, gods. How you feeling?
Hey, can you put the camera a little more up so that you can see on top of the table? And no one can see Wizzy at all. I mean, no one can see Knowledge at all.
It's a good idea.
See Knowledge.
If you put it on top, so it can see on top of something, they can see straight. They can see by picture. Can y'all see that y'all all could be seen on the camera?
No, the box. Put it sideways so it's not too tall.
We open it back in the box. Yeah.
No. Turn it so they can see on top.
There you go. Sit it on top so this way they can see everybody.
What it look like?
They can see everybody.
It look like you can't see Knowledge. And look, cause she
I can't see no Knowledge. So Knowledge ain't in the camera yet.
the one need to be everybody want to see.
Right.
Yeah, Malia definitely been crying. I see that too.
You can pull it back. Pull it back. Pull it back. All of that.
No, it's good because it's already shoulder.
Yeah, if y'all pull it back, you'll be able to see it.
Pull it back some more. That's all the way back.
Yeah, it's the feed the. She has the external phone. She can feed the chat.
There we go. There you go.
Got big wizard. Got big thighs, big wizard.
Oh, okay, I see it.
I bet the way Wizzy keep moving and fidgeting around, boy, I bet you them goddamn jungle mosquitoes tearing her ass up.
Can you see what's on the camera? I see
Look at man, this shit crazy.
I see Doka and what's the name, but I don't see the other woman. I guess that's because oxygen. That's good right there. That's good right there. Right there.
Right there.
Big Wizzy got some big ass titties, man. Look how big Wizzy titties is.
All right, Malia, go ahead and take your piece.
They be blowing it like that?
No, I don't think
It might.
So like walking like something in his ass. Look at him. Just look dumb. He looked back at Zoka. Look how he looked at Zoka. Man, this shit crazy than a song, bitch, man. Just got a little Solar sad as hell, man. Got that motherfucker delivering pack. Solar, you could have worked for Amazon. You could have worked for Amazon, man. All that other shit, man, irrelevant, man. You ain't making no bread fucking with Clubfoot, man. You could have worked for Amazon, man.
we just need. Oh yeah.
We got. He a little hoe.
The tripod for that.
Yeah.
Tripod.
Apple.
iPad tripod. All right, cool.
Damn, Wizzy, motherfucker big as hell. Look at Nubian with
Malia
this
not
weak ass.
in the hospital no more. Y'all tripping. He just
They were trying to
doing something.
Nubian and Solo were trying to hurry up and get back to that video game.
Go ahead, talk.
Well, peace to God. How you feeling? Peace, God.
Let's go.
You can't blame anything on anyone. I can't blame my situation on carbonation. I can't blame my situation on the women. I can only blame it on myself because I did it to myself. The only way you can stay in that environment is if you heal your mind, if you are willing to do the work, if you're willing to apply the knowledge and look at self and not point the finger at anyone, because that's a high vibrational frequency. No one there is like Babylon. Babylon, they point the finger at everybody. They say, oh, you did it, and don't look at self. But if you don't look at self in this environment, then you are bound to fail because we are elevating. We are trying to heal our mind. This is a war against self. This is a war against the mind. This is a war against your lower self. So if you don't defeat your lower self, then you will always be in your self. And so that's why I'm in the predicament I'm in now. Because
Funny how they steady talking over her, but a motherfucker can't talk over nature, boy. He get mad.
I wasn't taking the commands like I should. I wasn't taking the discipline. I was resisting because I feared I feared elevating because I looked at it as it was hard or it was tough, but in actuality it's for me. It's healing me. It's nothing against you. It's everything working for you. And so I didn't see it like that. I seen it in another way. I seen everybody as my enemy. I seen everybody as something other than my higher self.
Look at Wizzy's face the entire time. Look at how she looking at nature, boy. Because she ain't looking at Malia. It's impossible for her to be looking at Malia because she's not even looking at a phone. So I wonder what nature boy is telling Big Wizzy. I wonder what nature boy done actually put out there, as far as like, what the theme of all of this shit right here might be or whatever. Just peep game. Just keep looking at it. Wait, just her facial expression and jump. See this shit? Now, when he talking and the video continues, check out how she keep peering and, you know, just keep looking over there where he at.
And so I was pushing everybody away. And so I wasn't receiving or even allowing anyone to help me. So I was getting sick. I was getting depressed. I was becoming depressed. My
Look at her eyes. Look.
Started becoming more and more negative as the days go by. I got smaller. I wasn't getting nutrients from my food. I became not creative anymore. I wasn't expressing myself. I wasn't being authentic. I was always in the room, in the bed, under covers.
Well, why did you do that under pressure? Why, you know, you could tell a lot about somebody under pressure. Why did you turn into that once you were faced with your demons and once you were faced with your issues? You know, because most people want to victimize things, right? When you come here, we face it to you. We face yourself with you, right? When faced with yourself, why did you start to go inward and get depressed? And then, like, why were you fighting? Why are you resisting just doing the work and correcting yourself?
Because I wasn't ready. I wasn't prepared. I thought I was, but I wasn't. And so, yeah, I just wasn't
how you
ready.
know that you are now?
I wasn't
know that you are now. How do you know you coming back is not going to put us in a circumstance where you do the same behavior, go right back to the same point?
Well, because I'm in isolation and I'm by myself and I'm seeing everything that caused them, that, you know, those problems or caused me to be in my lower self. So I'm seeing everything, and then as I watch more of the knowledge and as I'm in isolation by myself, I get to see and I get to write, I get to experience myself and feel it and not run from it or point the blame at no one else, because I'm noticing.
Can you tell everybody what happened to you physically? Do you have HIV? Do you have HIV? Did the doctor test you positive for HIV or any other STDs? Please tell the world.
No, I don't have any STDs. I don't have any AIDS. I don't have any diseases or any complications.
She said any AIDS. She didn't say any HIV. If you caught that, I don't have any AIDS. Any AIDS. And of course, as it was stated a little earlier, man, shout out to Prince, man. I see you, man. I appreciate that big donation, man. Straight up, man. Yo, that is what's up right there, man. The brother hit me off and said, for salute, King, you the king of content for real. I appreciate the hell out of that, man. Just hearing that alone, man, is one thing, man. But donating like that, man, is another thing, man. That's why I get out here and I do this, man. That's why I get out here and make sure, you know, that I can go live and present this stuff, man. I get a lot of flack just from doing this right here. Guys be upset with me and stuff. They get upset with me and stuff because I asked for $3. I ain't even gonna tell you, man, what the brother just donated to me, man. I ain't even gonna put it out there like that, man. But I appreciate the hell out of that, man. Just know that.
Agents with myself, as far as those, you know.
So why would your sisters sit there and tell them that the doctor told them that you had STD?
It's funny. Once I said I want to go back to carbonation and join my soul family, they was totally against it. They in their minds didn't want to accept it. From their mouths, they said, "Okay, I'm gonna allow you to be you. I'm not stopping you from being who you want to be." But it was a different story once I physically said out of my mouth, "I want to join carbonation again. I'm going back." They didn't accept that. They didn't like that. So they went on this panel and started talking all crazy and nonsense about me and saying that I have this and I have that, but they don't have the proper information or don't have the true information.
They said that they took screenshots of your medical records. Is that bullshit? Because did anybody see any screenshots?
Now
I didn't see no screenshots. I didn't see none of those medical records.
She was getting ready to tell it on herself. She was getting ready to say, now I kind of moved the phone, you see. She didn't go into that part, though.
Well, I physically spoke to my doctor, and my doctor told me that no, you don't have AIDS, or you don't have a disease, or whatever they said that I had. I don't have
STDs. So depression was a cause. Do they know what the cause of the fluid around your heart was?
They know for sure that it started from my uterus. Because I wasn't I didn't allow myself to let go of my Babylon son, or I'm still holding on to it. I didn't allow myself to hold on to my Babylon son. I mean, let go of my Babylon son. I didn't let go of my Babylon mom, and I didn't heal myself from my sister's situations. So I was holding on to a lot of fluids in my body, and by me not expressing it or communicating or talking about it or expressing myself creatively, it backed up in my system. It backed up. I had fluid around my heart. I had fluid around my kidney and my lungs, and it was pushing.
So your suffering came from your attachment
up against the other organs.
Your suffering came from your attachments.
So
somebody asked a question.
Why he don't let her speak? Why he gotta keep cutting her off and shit every time she wanting to talk? See how fucked up this is? That shit all over Aya and F-Ru. Can't even look at it. Don't even have nothing to say. Just think, normally, if these women were at one time your sister wives or either, students, within the same university that you was in, why wouldn't they be excited to see her? Now, you just seen a few minutes ago, they brought that damn air fryer out there. Sheba was cheesing like a motherfucker. But ain't not one person cheesed not one damn time since Malia has been on the phone. That is crazy. That is crazy, man. Somebody put Big Wizzy gonna be out by Monday. I don't know. But let's go.
They said if they think that Malia is so sad, why don't they just give her son back? Because that's what she's literally sad about. Someone asked that on one of my posts. There's like, if a family cared about her so much, won't they bring her son up there? Won't they give her son so that she will be happy? Because the source of her issues seemed to be her son. If they cared about her so much, why they keep keeping her son? Because you did ask them for your son, they wouldn't give him back to you.
That's wild, yo. Hey, yo, Break Heart say having fluid around your heart has never been deemed as a symptom of depression. That's crazy, man. That dude done told us some shit like that.
That's a great question. He said because her son is not safe in carbonation. But at the end of the day, that's her son.
You say she's scared. Hey, man, it's something up with that, man. Now Malia wiping tears. It's something up with that, man. It's something up with that. And I think Nature Boy, you know what I think on some G shit? I think Nature Boy wrote something on that whiteboard and told her, keep on painting, keep on acting normal, keep on doing this recreation, these little, do your art right now. Don't worry about Malia. Because you see how Zoka and F-Ru picked up on it. And you see how Aya sitting straight while everybody else turned the other damn way, because she got to watch everybody. She got to make sure everybody else is coloring. She got to make sure everybody else is in line. Like I told you guys before, he done used Aya several times to be able to rehearse and to continue to manufacture all these motherfucking lies that he putting out here. Now, Wizzy, on the other hand, she knew. Of course, she probably done heard about some stuff about, D baby. But this stuff with Malia, shit done got real to her now. Like, she see this shit really motherfucking real. She trying her damnedest right now just to maintain. I can see it in her. And the other time she'll be looking with you. Look. Look at Zoka trying to read that whiteboard. Look at it. Look.
Why
She
you
like,
reading the chat instead of answering the question?
See?
Oh, I thought I didn't know you wanted me to speak. When I continue to ask for my son back or get him back, my Babylon family noticed, I guess, noticed my behavior and noticed how I was in carbonation, and they didn't agree with it. They see me as this, this psycho person, so because they don't understand. So I as I called and asked to get him back, they told me no, because they seen the behavior, and they also took custody of him, and they kept telling me you would have to go through the courts, you would have to go through the systems to get him back. And after that, I just noticed how the universe just kept telling me, no, you can't get him back. You can't get him back. So I just took it as, okay, this is not his journey. And this is not my journey to have him. So I left it at that. And I understand that he's me. He's 23 of me. He's not separate of me. I am him. So I understand that. And I
want to know, when is Wizzy gonna paint something? She been sitting there fucking with that paint tray for a minute, ain't she? What the fuck is she doing, yo? She ain't painting shit, McDouble. I'm sitting there looking at this shit like, yo, when the fuck is you gonna paint some shit? What the fuck is going on, man? It's like when a motherfucker be nervous and they be doodling and shit, just doodling on the paper, just, That shit weird as hell. I say, is that a bull on it? I don't. No, that's like she has on some. I don't know what the fuck that is. I thought it was a damn necklace, to tell you the truth. I don't know. I ain't been noticed that. I guess as she moved, we can see it at another angle or whatnot.
Came to the terms like, okay, maybe it's her journey, my Babylon sister's journey to have him. So I just once I came here, I seen like videos of him, like FaceTime videos of him, and I just was like, you know what, you keep him. Like I don't want to keep going.
But let's take some responsibility here. Let's take.
Yeah, I left him.
Not knowing that the dad, you didn't tell me the part that the dad
Wizzy got some big.
The dad's name wasn't on the birth certificate when I left. When I left, I didn't tell anybody about where I was going. I didn't explain anything to anybody. I didn't communicate anything to anybody because I knew that they wouldn't understand the first time I left. They wouldn't understand what I was going to do with my journey. And so I just up and left. And when I up and left,
I don't know what that is.
And when I got to join Babaji's life, I ended up communicating with them over the internet through going live. And so I found out that the child's father, his name was not on the birth certificate. And so from that, I could have took him with me if I would have, I guess, paid attention to details. I would have slowed down. I would have, did all those things, but I didn't. And so that I have to take responsibility for that.
But they saying I made you leave the son. They said I made you leave the son.
I'm explaining to you what I did.
That's not true.
But I'm explaining to you what I did. So how are you still going to sit up there and say it was Baba G's fault when I'm sitting up here explaining to you what I did on my journey, what I decided to do as a human being, as a grown-ass woman? Y'all gotta stop.
But you don't have, but
other people. Yeah, that's Babylon.
Yeah, it's true. And the thing is, like, these is demons. Like, these are some real devils. Like, these people are sick to even want to know so much details about somebody else's life to the point where they're investigating you and they're like, they're interrogating and like, it shouldn't be that serious to these people. But these people like, well, what you did is, what you did that, what you did, you said this, and you said that. Fuck y'all. This shit is crazy, my nigga. Like, these people should be this invested in no one else's life. The fact is, she don't got no STDs. The fact is, she don't got no more fluid on her heart. She's out the hospital. She's leaving the hospital. She already left the hospital. She's just back there getting something for right now. She's doing good. She's okay. She doing what the fuck she want to do. Mind y'all business. Stop spreading vicious rumors. And every investigation y'all do is going to fail because it's not true. So keep spreading vicious lies.
You see when she looked back like that, she was telling somebody in that hospital, like, I know he talk loud. I know he talks a lot too. Yeah, I know he talk loud. I know.
When y'all fall on y'all face and y'all realize y'all can't beat us, y'all going to join us. Period. Thank you, Malia. Thank you.
I can explain. The reason why I have fluids on my uterus because I didn't let him go, and from the uterus it traveled all the way up, and it started to take over the kidney, and it started to take over the liver, and then that's when it took over the heart, and it started to slow my heart rate down.
Oh my goodness.
Slowly. Hi, how are you doing?
There you go. Mind if I come in? Let me adjust the volume a little bit.
I have to calm down, y'all.
Is that your doctor?
Yeah. Who are you?
I'm Dr. Patel. It's my name up there on the board.
Yes.
So did you have any STDs that caused the problems?
Do you have any information about my medical records stating that I don't have any STDs or anything?
I can find out.
Okay.
I know you've been there in the hospital for a good time, right?
Yes, I will.
Recently. So yeah, I can find out about that.
Okay.
What specific question?
Does she have HIV? Does she have HIV? Does Malia have HIV?
Yeah.
And stating all of my procedures that has been done, all of my medical records that has been done, so I can have physical proof of,
of course.
information.
So before you leave, there's a medical records department, and you can ask one of the nurses to help you get there, so you can get your medical records. If that's not the case, then I can get like my residents print out some stuff, but it's not official. It kind of doesn't. It's not. It may not be the best way to get all your records.
But this is a different doctor, stupid. She got like 5 doctors on shifts.
See how he talking?
But the doctor
saying stupid and stuff like that. Like that shit is wild as hell, man. She's sitting there talking to a medical professional. You know what I'm saying? A motherfucking physician. She's sitting there talking to this dude. Like, what the fuck is wrong with Clubfoot, man? You know how fucking embarrassing that is, man. He using all that vulgarity on the damn phone when she's sitting there talking to somebody that could possibly help her or have helped her. That's why people stereotypically talk a whole bunch of shit about black people in public. Always talking about we too loud and shit. I'm keeping it a book, man. Some of us do be too motherfucking loud and need to shut the fuck up. Sometimes, man, you say shit out of place, man, out of order. You gotta sit back sometime, man. Analyze shit, man. Look and see what the fuck going on. See, that's telling you right there within itself how controlling that nature boy is. He even want to control the situation right now with what the doctor could tell her about what's going on with her. He's denying that he don't fucking know. He ain't in the fucking hospital. He ain't no motherfucking MD.
He could tell you if you have any STDs. He should be able to tell you.
Reasonable.
Yes. And what's your name?
Dr.
And it's
PAT.
PAT.
Yeah, that's okay.
Do you have any information on when I'll be leaving?
So that's what we're working on. So my understanding was that you didn't like the facility.
No, I didn't like how they spoke to me. I didn't like the scenery, the physical, how it looks. I didn't like how it operated. I wasn't agreeing with it. So
so the next option is trying to get you home health home.
Yes.
So
that's fucked up.
Trying to work with peers and peers. that's gonna ultimately determine how long.
Y'all don't know shit. Y'all need to mind your business.
So that's kind of what we're at right now, is trying to figure out how to get all that stuff for you.
Right.
It takes a little bit of time. I'm sure trying to come through So I'm hoping for that to get you up sooner or later. I can't guarantee. I can guarantee one of the Sounds fair?
They didn't say no disease specialist. Did they? Malia, did he just say a disease specialist?
No, infectious disease, meaning for all the fluids. They want to look at to see if all the fluids are being drained.
Yes, but can you ask him to pull you records to see if you have had?
Yeah, I would have to go to. I would have to do that.
But then you said you asked the doctors before if there was anything in your records that said you had any STDs.
That's the same thing that I said today, Lena Jones. I said the same thing. I ain't never in my life seen no doctor standing around that long, man. I'm talking about them mother be moving, man. They'll come in, say some shit, stand there for a minute. You okay? This and that. Boom, and they gone. Man, that man done been standing there now. Longer than 5 minutes. Keep it real. Just think about it for a second. He been standing there for a minute talking to you. What doctor does that as if she's the only person where they are? What doctor does that as if that, you know what I mean, he has no other patients to attend to? That's how you know that this shit crazy as hell, man.
So I will physically have to go and get the paperwork. And it's in this hospital.
Correct.
Okay.
But
So
he
can't
tell you. He can't tell you about your own paperwork.
This actually is not the same doctor, so he may not have all the information.
Okay.
As the other.
You see how pressed that Nature Boy is? So he can't tell you. If we got that shit or not. That's what I got out the shit. That's word up. And I'm pretty sure the rest of the women should now be thinking like, yo, like, what the fuck? I don't understand why they couldn't have just hit I'm going to the bathroom right quick and go ahead and dip out. One of them need to dip out. They need to dip out and start running fast as they can. You ain't got to do nothing. Run down to the bottom of that hill. That's all you got to do. When you can run down to the bottom of that hill, take a left. It'll come to you. I done seen what the bottom of the hill look like. Make a left, go straight down, then make that right. Where the road is like a four-way make that right. Yep, that'll take you right where you need to be. It'll take you right where you need to be. I guarantee you that. Hi, Dale.
The other doctors did that was actually working with me for that.
But he can go see your records real quick to tell you if you tested positive for any STDs, right?
Yeah. Yes.
Can you ask him to do that and come right back to tell you?
Huh?
Can't you ask him to do that to ask him?
And you know what? I didn't even notice that shit the first time, Octavia. I didn't even notice that shit. You are exactly fucking right. When Nature Boy dumbass sitting there asking her to ask the doctor, and then, you know, sitting there dumbfounded, like, why he can't tell you this and that and this and that? Duh. Octavia say, peep how the doctor act like he didn't know what the medical records are. The doctor know what's up. See what I'm saying? The doctor know what's up. You better believe somebody done called and told that man. Well, you know, even if they ain't called, I'm calling them all any damn way. So it don't make a fuck. It don't make a fuck, Nature Boy. It don't even make a fuck, because I'm damn sure gonna tell him. I'm telling him I got a whole lot of YouTube page. You can watch all of the videos. I've been talking about this motherfucker for so long, and she just so happened to been with this guy, sir. Sir, I also got to show you this video when they was on the beach fighting and shit. Yeah, I'm dead ass serious. I'm damn sure gonna call him. I'm calling them up about 10 o'clock in the morning. I'm dead ass. I know Patel phone them. Shit. Think I ain't. Shh. Fuck that shit. You know how hard it is to get in touch with doctors and shit. Man, it don't make a fuck. I know out of these 449 people that I have,
I know at least 5 people gonna hit me in my DM asking for the phone number, and I'm gonna give it to you. Just be like, hit me up and be like, number. You ain't even gotta fuck with me. Just say number. I'm gonna get that motherfucker straight to you. Number. And that's how we move it. We're gonna shut this shit all the way the fuck down, man. Just in case the doctor don't know. But I honestly feel like that he feels as if that this woman is in somewhat of an abusive relationship. I think that judging by what actually took place, as well as the beatings. You remember on that picture where Nature Boy had her ass? He had beat her then. He beat her then, yo. Patel say he ain't no man, but you know Patel know. Come on, man. You know Patel know. How Patel could know? That's an even better damn question. How couldn't he have known? I think he just didn't want Nature Boy to know what the fuck was going on. That's all I think that is right there. That's all that is.
Too much to make sure she's straight. You feel me? Since y'all must know all the fuck. At the end of the day, if she had HIV, she would be taking HIV medicine right now. What the fuck are you talking about? You know what I'm saying? Like
in a damn bed.
Look, it's not disrespectful to Malia. It's y'all being disrespectful since y'all want to know. Since her sister put her out there, we just trying to let y'all know what the fucking truth is. Number one, this ain't the doctor that was with her. She's just some random doctor. He don't really know what's going on. Feel what I'm saying? But the other doctor did tell her out of his mouth. You feel what I'm saying? And these people are mean. They're inconsiderate. Y'all the reason why part of the reason why she's in the hospital.
No. We're not part of the reason. We're not part of the reason. I do take a little bit of credit for at least getting Malia some medical attention. But come on, man. Stop trying to make it seem like everybody did something or one particular person did something except you. You need to grow up, Nature Boy. For real, man. I feel you, PYT. Yeah, Tootie, this shit is crazy, man. It's sad. Thanks for everybody that tuned in. I'm going to go ahead and get up off here, man. That shit got me all the way in my feelings, man. She got me all the way in my feelings right now, yo. Like, I feel some kind of fucking way right now. I really feel some kind of way, man. Some of y'all still support this motherfucker. Some of y'all still watch this motherfucker. Some of y'all cool with this old bitch ass nigga. I can't stand this motherfucker. That's word up. And like I say, man, positive energy goes out to Malia's family. If you're listening, Tanisha, positive energy to you as well. We don't hate you. We only hate him. And we are in a very, very large disliking on what took place with all of this and how you've been affected, you know, by this, just by dealing with this cult leader. I urge everybody, I repeat, everybody, to not only pass on this information, but I urge you to pass on all information pertaining to Nature Boy. I don't give a fuck what channel that motherfucker on. I don't give a fuck what channel it's on. If it's anything that got to do with Nature Boy and somebody asking a motherfucking question about it, anywhere you find the videos, make sure that you show it to people to heighten the awareness. We know what he doing and what he did is wrong. Let's continue to talk about it, man. Like I say, man, I definitely will be up early in the morning. We'll be on deck. We'll probably be on Instagram tomorrow on the 4-person Instagram panel. Yeah. So hopefully, you know what I'm saying, I got some people that's going to come through and, you know, at least build with me. We try to switch it up and get some new people up there tomorrow, man. See if I, you know what I mean, just to get the just to switch the perspective. Just to switch the perspective. You feel me? All right, that's what's up. All right, man, y'all enjoy, you know what I mean, the rest of your morning. I'm going to catch y'all a little later within the morning. Like I say, man, y'all send positive energy to Malia. Send positive energy to her family. And more than anything, if you really care, pray for her son. Pray for her son, man.
Pray for a son, okay? I see